Hi, this is Joycy Pranabdev. This is the week discussion 12 on ADHD treatment, nursing class 5663, psychopharmacology psychotherapy, instructor Dr. Gina Wilcox. The medication name is dexmethylphenidate. Brand name for that is Focalin and Focalin extended release. Generic name dexmethylphenidate. The prescription cost for this medication through Medicaid, Blue Cross Blue Shield and self-pay through the United Pharmacy with a coupon for 10 milligram tablet for 60 tablets is cost $30.96. With using Blue Cross Blue Shield insurance basic plan for the capsule 5 milligram for a month supply, it costs $7.50 and you can pick up on the store. Extended release tablet 5 milligram, extended release 5 milligram capsule 30 without the insurance would be that pay $128.33. That is in the Grandview Pharmacy in Elk City. And through the Medicaid and Medicare, there may be more discount using according to the individual's benefit plan. How does the medication work? It is a central nervous system stimulant, blocks the reuptake of norepinephrine and dopamine, and increases their release in extraneuronal space. Increased dopamine and norepinephrine actions in the different parts of the brain, such as basal ganglia, dorsolateral prefrontal cortex, medial prefrontal cortex, and hypothalamus, and it helps to improve attention, concentration, wakefulness, improve depression, fatigue, sleepiness, and improve hyperactivity. The starting dose and the maximum dose prescribed for this medicine, more than 6-year-old dosing is immediate release form 2.5 milligram to 10 milligram by mouth 2 times a day. Start on initially 2.5 milligram by mouth 2 times a day, then increases by 2.5 milligram to 5 milligram per day if needed for every 7 days, and the maximum dose to be 20 milligram per day. Extended release form for 6-year-old dosing is 5 to 30 milligram extended release by mouth every morning. Start by 5 milligram every morning. Then it can be increased up to 5 milligram per day every 7 days, and maximum dose to be 30 milligram per day. Adult dosing, immediate release, oral initially start on 2.5 milligram 2 times a day, may increase the dose based on response and how the patient is tolerability in increments of 2.5 milligram to 5 milligram at weekly intervals up to a maximum dose of 20 milligram per day. How long does this medication last? The short-acting onset of action in 30 minutes and duration 3 to 5 hours. Extended release Focalin tablets are 50% of immediate release and 50% delayed release over to 10 to 12 hours. Long-acting, the onset of action 50% immediate release and 50% delayed release over 8 to 12 hours. Can nurse practitioners in your state prescribe this medication? If so, are there any restrictions? I'm sorry. Dexmethylphenidate is a Schedule II controlled substance medication with a high potential for abuse. The nurse practitioner in Oklahoma cannot prescribe this medication. It has to go through the physician or psychiatrist. Side effects of the adverse effects. That picture showing for the adults the common side effects: insomnia, sore throat, dizziness, heartburn, dry mouth, and nausea. These all are the common side effects in adults. Central nervous system is affects as a headache in children and adolescents, chances of 25%, insomnia 5 to 17%, jitteriness in adults, anxiety 5% to 11%, depression, emotional lability in children, drug abuse, drug dependence, agitation and psychosis. Dermatological, it shows pruritus, gastrointestinal, decreased appetite, abdominal pain, nausea, dyspepsia, vomiting and anorexia in children and adolescents. Adverse effect listed for the use of central nervous system stimulant treatment causing sudden death in children and adolescents with pre-existing cardiac diseases, stroke, MI, also reported in adults. Stimulant should not be used in patients with any cardiac diseases, must need a thorough physical exam to assess for any cardiac diseases, and recommended testing are ECG and echocardiogram. Peripheral vasculopathy, it can cause the Raynaud phenomenon, symptoms of mild and intermittent. It needs to monitor for digital changes during the therapy due to side effects as digital ulceration. This medication should use cautiously with people having hyperthyroid, hypertension, CHF, psychosis, bipolar disorder, seizure, and any substance abuse history. Rarely it causes priapism if the condition lasts more than 4 hours, painful and non-painful erections, and sometimes it may end up in surgical intervention. This medicine should be used cautiously with people suffering from psychiatric disorders. The patient should be screened for psychiatric disorders before this treatment. Evaluate for motor tics and Tourette syndrome before therapy initiation. Stimulants cause pediatrics to have appetite suppression, weight loss, slowing growth rate. It is important to monitor for growth rate, height and weight during the time of treatment. Drug-drug interactions. Contraindicate use of bensphetamine, isocarboxazine, linsolid, methylene blue injection, phendimetrazine, phenelzine, safinamide, selegiline transdermal, tranal, cypromin, and yohimb. Blood pressure medication should be used cautiously. It can drop blood pressure. MAOIs should not use in 14 days. It has interaction with SSRI, anticonvulsant, tricyclic antidepressant, coumadin anticoagulants, may inhibit the metabolism which may be required dosage adjustment. This medicine should not be used with clonidine also. Patient education. It is important to know dexmethylphenidate can be habit forming, should be taken in small doses, also be taken according to the prescription. It can lead to adverse effects if taking a large amount of medication, should be adherent to the treatment plan according to the prescription, and also important to keep the appointment as scheduled. If any unusual behaviors, should notify the doctor immediately. Common side effects of dexmethylphenidate include trouble sleeping, nervousness, dizziness, dry mouth, heartburn, nausea, stomach pain, headache, loss of appetite or weight loss. If you are experiencing any of symptoms such as irregular heartbeat, sweating, dilated pupils, unexplained wound on fingers or toes, fever, itching, hives, abnormally excited, more restlessness, difficulty falling, sleeping or staying asleep, hostility, aggression, anxiety, appetite decreased, loss of coordination, uncontrollable movement of part of the body, flesh, skin, vomiting, such stomach pain, or thinking about harming or killing oneself or others, or planning on trying to do so, you should let the doctor know or call for immediate help. Avoid the use of alcohol and any street drugs. Never stop taking the medication abruptly. You should taper down by using medical professional advice if you have to discontinue the medication. Do not give away, sell, or give this medication to other people. Keep this medication away from the children. Dexmethylphenidate comes as a tablet or extended release form. You can take this medication twice a day or at least 4 hours apart with or without food. Notify your provider if symptoms worsen. If you have any allergy reaction, let the doctor and pharmacy know immediately. If you are allergic to dexmethylphenidate or any of these classes of this medication, discuss with your doctor and pharmacist. Discuss with your doctor if you are taking monoamine oxidase inhibitors included isocarboxyl, linezolid, methylene blue injection, phenelcine, and tranylcypromine. Call 911 if you are experiencing any signs of allergic reaction such as fever, hives, difficulty breathing, swelling of your face, lips, tongue, or throat. Tell your doctor if you are taking any non-script medication or prescription medication, vitamins and nutritional supplements or herbal products, anticoagulants such as warfarin, opioids, depressant, decongestant, diuretics, any nausea and vomiting medication, Parkinson's disease medicine and non-stimulant medication. All this can cause serious adverse condition as serotonin syndrome. Also report if you are taking any antacid or other medication for the heartburn or ulcers and if your family ever had Tourette syndrome. Discuss with the provider if a family history of a heart attack or stroke or irregular heartbeat or died suddenly anyone in your family by heart attack. This medication is to keep tightly out of reach of children. Contraindications to use people with severe arrhythmia, coronary artery disease, glaucoma. Also use if hypersensitivity to methylphenidate or any component of this product. Don't use with or within 14 days following discontinuation with monoamine oxidase inhibitors. You should not use this medication if you are pregnant. If you are planning to pregnant, discuss with your provider. Question number 10. Best practices before prescribing this medication. Example, labs and tests. This medication has a very high risk of abuse and dependence, so it is needed to have a thorough assessment for the risk of dependence, abuse history, and alcoholism. During the treatment, monitor for signs of abuse and dependence. Periodically assess the need for dexmethylphenidate tablets. Screen for people before prescribing if any presence of cardiac history. Ask about cardiovascular history, family history of sudden death. Need a thorough physical exam. Should not be used in children under the age of 6. Give proper teaching about medication use and side effects. Blood pressure monitoring regularly is important factor. In children should be monitor height and weight, CBC, platelet count, and liver function periodically monitored to avoid any adverse effects and any emergencies. Thank you for viewing my video and we'll see you more through the discussion post. Thank you.